Hi, our group topic is intimacy and sexuality in the elderly. I am Carrie Parker, and you will also be hearing from Rabea Nazier and Amanda Nichols. The need for touch is a basic, primitive need. From birth, humans are comforted by the touch of their parents and caregivers. As humans age, this need is still a fundamental part of overall health. Touch, intimacy, and sexuality go hand in hand to an older person's sense of well-being. Intimacy is more than just sexual activity. It includes friendships and relationships, both sexual and platonic. Older adults continue to seek out intimacy and sexuality. Sexuality is a key component of a healthy life, and it includes sex and pleasure. Now let's discuss some health concerns and trends when discussing the older adult and intimacy and sexuality. The aging process changes the body externally as well as internally. The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being related to sexuality. Older adults are faced with health concerns that contribute to their sexuality. Sexually transmitted infections, STIs, and human immunodeficiency virus, HIV, among Americans 55 to 64 years old is steadily increasing. Women'sHealth.gov reports that nearly 1 in 4 persons living with HIV/AIDS in the United States is 50 or older. This is in part due to the mentality of older Americans feeling safe from pregnancy and not practicing safe sex. Other concerns that older people face with sexuality is changes that occur in the body that is gender specific. Approximately 44% of men aged 65 to 85 report that they experience erectile dysfunction. Most men are aware of this condition and possible treatments. Older women are also affected by sexual dysfunction. Once a woman experiences menopause, her levels of estrogen begin to drop. This lack of estrogen can lead to vaginal dryness and thinning of the vaginal tissue and can cause sexual activity to be less pleasurable. Other diseases that can affect sexuality is not gender specific. These include chronic diseases and illnesses such as chronic pain, dementia, diabetes, and heart disease that can cause sexual dysfunction as well. Now Rabea will discuss nursing interventions and teaching and learning strategies.
Hi, this is Rabea Nazier and I'm going to talk about nursing interventions. Sex and intimacy cannot be ignored since adults are living longer and healthier lives and engaging in a variety of intimate and sexual behaviors. So it is very important for nurses to improve the health, safety and well-being of lesbians, gay, bisexual and transgender elderly individuals. Nurses can advocate for their patients. Having a practice environment that supports nurses in raising ethical questions and empowering them to address those concerns is vital. Educate regarding age-associated changes in sexual function is very important. Nurses can also promote healthy sexual behavior. Nurses can strengthen community capacity and increase access to quality services to improve sexually transmitted diseases. They can effectively manage acute and chronic illnesses affecting sexual functions, can educate them about HIV and other sexually transmitted infections and reduce the risk factors. Nurses should communicate effectively. Nurses should use clear and understanding language and be available to discuss the subject, make them comfortable to express feelings and needs, provide discussion groups one-to-one, and so that they can ask questions. Nurses also should consider the cultural differences. First, they need to obtain permission from the clients to initiate sexual discussion, provide privacy, make opportunities for one-to-one discussions, allow time to ask questions, making information exchange understandable and problem solving acceptable to culturally diverse communities are valuable contributions made by the nurses. Be open-minded and ask and talk openly. Help to develop support groups. Ask direct questions about sexual activity and attitudes to address healthy sexuality for this population and provide them with sexual-related health care. More and in-depth exploration in this subject matter is very necessary. Nurses should listen to the client so the client feel like that the nurses are interested in their problems. It is certainly advisable that medical care providers who are uncomfortable discussing older women's sexual concerns be prepared to make appropriate referrals to clinicians who possess the proper training to accurately assess and treat sexual changes, which is very important. Now I'm going to talk about learning and teaching strategies. Nurses can teach older adults who are sexually active should talk to their healthcare provider about sexually transmitted infection testings. All sexually active older women with risk factors such as new and multiple sex partners or who live in a community with a high rate of diseases should be screened annually for chlamydia and gonorrhea. Education and counseling about sexual functions, adaptations for age-related changes and chronic conditions. Encourage the person to learn more about the concern from books and other resources. Offer suggestions, deal with problems such as lubricants for atrophic vaginitis or use of condoms to prevent sexually transmitted infections. Nurses can provide available resources to their clients, offer to find solutions and alternatives to a given situation, because sexual activity has positive effects on older adults' physical health, and it is very important to resume a sexual relationship after an illness or traumatic event. Nurses can help to develop a development of counseling, training and empowerment programs for seniors with chronic diseases. Nurses also can review medications. Some of the prescribed medications to the elderly can have effects on sexual side effects. So nurses can help to adjust the doses and use alternatives. Thank you.
Aging can cause changes to occur that have negative impact on sexuality and intimacy in persons over the age of 65. The National Institute on Aging maintains that physical changes are the leading cause for such issues. Physical changes referenced by the National Institute for Aging are decreased lubrication and muscle swelling in the vagina, which lead to painful intercourse and therefore can overall decrease the desire to maintain such relationship. Erectile dysfunction in males over the age of 65 is also one of the leading causes for decline in intimacy. Decreased mobility is very common amongst persons over the age of 65, as the bones of the joints and muscles don't work and communicate as they once did. And ultimately, that decreased mobility can have a very negative influence on the actual engagement and the mechanism of actually performing such sexual encounters. Loss of sexual organs that occur just with surgeries and as a result of natural aging to the body can impact how the body actually performs and once again decrease desire. According to Mayo Clinic, psychological issues are for a large part responsible for intimacy issues as well. Confidence and self-esteem are often decreased as the body ages, as the person just doesn't feel as they don't feel and see themselves as they once did. Stress related to performance can ultimately have a negative impact on a person's stamina and ability to perform. Altered body image is often cited as a reason for decreased intimacy, as a person does not find themselves attractive and may fear that their partner does not find them attractive. Physiological changes related to health conditions such as COPD, heart conditions, stroke, also cancer, and diabetes. These are all things that can directly impact intimacy and sexuality and create issues for persons who would like to engage in such activities. Medications that are prescribed to these patients that have health conditions can also have a negative impact and influence on the body's ability to perform. As far as treating these patients, there are some alternate care options to consider. Most of the time, as the body ages, all of the adverse effects of aging cannot be reversed, but there are certainly some things we can do for our patients to help them. Hormonal treatments such as estrogen and testosterone are good additions to a person's care and can encourage the stamina and performance of the patient. Lubrication, just a manufactured lubrication can and very much so increase the actual enjoyment of the intimacy and intercourse and can decrease pain. Urologists recommend a penis vacuum, which actually pumps blood to the penis and engages the muscle. Therefore, it will help with any kind of erectile dysfunction. Sex therapists encourage increased foreplay as it relaxes the body. It loosens the muscles and it increases lubrication and can have a positive impact on the feeling of sex and decrease in pain. Some doctors can provide a patient with stimulant medications as long as they are safe in combination and collaboration with their treatment plan, and can ultimately help counteract some of the adverse effect of certain medications and health conditions and overall problems with performance. In conclusion, to encourage healthy and intimate relationships, we want to debunk ageism and prejudices associated with elderly patients or elderly communities and sexuality. We also want to encourage alternate ways for patients to be intimate if they find that they are unable to perform. Sometimes intimacy in other ways other than intercourse have the same effect on overall health. We also want to encourage communication with our patients and their partner to break the barriers to the problems that they're facing and can find a common ground to agree on together. We also want to encourage exploration and sexuality in finding what works for each other and ultimately what will increase desire. The next page is our references, and we hope you have enjoyed our presentation.